The nurse hasn't met Sarah before, and she's about to meet her in a new case consultation on the chemotherapy unit to discuss her new chemotherapy regime. Sarah will have been given information about her chemotherapy by her oncologist, but on this occasion the nurse wants to start by ascertaining how much information Sarah already understands, so that she can direct the conversation moving forwards. Hi Karen.
Hi.
I know that you met with the doctor recently. Before we talk today about the treatments, can you tell me what the doctor told you first, so that I can understand where your thinking is?
Yeah, I mean, he was, obviously we were talking about the chemotherapy because I didn't know very much about it, and I was asking about like side effects and things like that, and he was going on about, sickness and diarrhea and getting really tired. And there's one thing that I particularly honed in on, and it was the loss of hair. Obviously with chemotherapy you hear about it, but then he sort of said, yeah, you probably will lose your hair. So I'm thinking, it's quite a lot really isn't it?
Yes, and I think that's it's a genuine concern about the hair loss, because that's part of our identity, isn't it, and who we are.
Yeah, that's it.
Okay, so in terms of the hair loss, would it be helpful if I told you how we can try and help support you and manage things through that?
Yeah, that would be really, really kind of you, because, I suppose it's vanity really, but I do think, oh my goodness, I don't really want to be completely bored. I don't know how I'll cope really. I don't know. It's difficult.
Okay. All right, well, we can come on to talking about the coping mechanism later in the conversation, if that would help. But I think from a practical sense, we do have a wig service that we can refer you to if going down the wig route is something that you would like to explore.
Yeah, I mean, as I say, I'd rather have a wig than be bald, and, I think, yeah.
Okay. All right, well, we've got a designated team that will help with matching you up with a wig, and maybe you could have a little bit of fun with that. I had a lady this morning who was saying that she took a best friend along with her, and they had a play around with different styles and different colours, which was actually quite a surprise for her because she'd also been anxious. So basically, we can make an appointment to that team now whilst you've still got your lovely hair in place, and then they can either try and match you up with a wig that is of your colouring and style, or it may be that you fancy trying something completely different and going blonde and having a shortcut. It's entirely up to you. The options are really are open to you, and they can also provide some fabric, nice soft coverings that you can wear as well, because sometimes it can get a little bit hot and sticky under the wig.
Yeah.
All right, so how does that sound?
No, that sounds really helpful, thank you. And I mean, you see ladies with bandanas and things like that, don't you, quite a lot in the summer. So thank you, because I'm worried about that bit.
Great. Okay, so I gave you quite a bit of information there about the wigs and how you may go about that, just so that I can check that I've gone through everything with you in regards to that and being clear. Can you just run through what we've discussed today around that?
Yeah, what about the wigs?
Yeah.
Well, you said that you have, you can sort of recommend where to go for that you have a service that I can sort of go to, and I'm allowed to take someone with me if I want to choose and take my time. And also the fact that, you can recommend places where I can get some soft fabric for if I didn't want to wear a wig all the time. So
sure, yeah, that's great. And they will be able to provide you with those bandanas and cloth hats too. So
that's lovely, thank you.
Great.
Thank you very much.
You're welcome.
I felt that she listened. She didn't judge me because I was more concerned about losing my hair than any other symptoms I might had. And what I felt was really useful is she got me to sort of repeat back what she'd said, so that she was obviously concerned about being clear in her explanation, so I could take that away. And I really appreciated that.